Hello and welcome to Rive, Reflections in Veterinary Education. This week we are hosting a guest, and I'm super excited to welcome Zach Terlchow. And so this is a very special occasion. I think this is our first student guest. So Zach is a fourth year veterinary student at Virginia Maryland College of Veterinary Medicine. Welcome, Zach.
Thank you.
Yeah. And this one we've kind of had this on our list for a while, not you specifically, Zach, but we've had on our list for a while. Like we kind of brainstormed, different guests that we wanted to have on the show. And one of the things that was on the list was having a student and to get a student's perspective. So, this podcast is, as the name implies, about veterinary education. And so it's a pretty broad topic that we like to talk about. And the reason we wanted to, for this show is we wanted to get your perspectives because you have expressed interest to me in it, ending up in veterinary academia and teaching, and that was something that you were interested in. And so we are interested in hearing your perspective on, why that is. So really that's my first question for you is what is appealing to you about becoming a veterinary educator, or why is that something you have thought of? Tell us how you got that idea.
Well, it's kind of like a multifaceted thing in my mind. It's kind of progressed over a series of time. I kind of I've lived by this quote for like the last year and a half. It's kind of like um, it's called that old men plant trees to for shade they're never going to sit in. And I think it's kind of a really valid quote because it takes a lot of work to make things better, especially it's even harder when it's not for yourself. Um, and I think that the work that we do in veterinary medicine is it's really amazing things that we do, and we can make it so much better for ourselves and for others when we put the time in to try to make it better. And the only way we can do that is through education, I feel. Um, and the reason why um, I like the idea of going into education because it feels two things for me. One is I get to do what I originally intended to do with that school, and that's to help people. And then two, and by helping people, I help animals. So that's basically why I thought about doing education. Um,
Yeah. So, I mean, obviously, veterinary medicine, the practice, what traditionally people think of is still helping people. But I guess, for you, that's a little bit more direct or feeling like a greater impact. Or do you think, or do you mean because through education, you feel like you can have a greater impact on the profession? And so it's going to help a bigger number of people? Like, tell me more about that.
I think like helping students, like it makes waves and waves make waves. And by helping this generation of veterinary medicine, we help next generation of veterinary medicine. And it starts with the students. And I remember um, when I was a high school student and I had no idea, no direction on where to go. And it took one person in my life when I was in college to actually point me in the direction of veterinary medicine. Um, and to find somebody who would actually like take a chance on me and to like mentor me meant the absolute world to me. And I felt like if I had somebody in my life when I was a high schooler to point me in the right direction, then I could have saved so much time in my life to do what I actually wanted to do. Um, and so that's kind of why I think education is so important, to have mentorship, even if it's not in necessarily in an academic role. Even having like somebody on an externship, being able to like lead them in the right way, or having a shadow at your clinic, like being a good like model veterinarian. That's kind of a
Yeah.
weird term, like being a good model for them so that they can make the right decision if that's the path that they want to go. I think that's super important. So by investing into education, investing into students to advocate for the profession, it allows us to improve the profession eventually.
I like it. That's awesome. I also really like the quote, or it sounds more like a proverb to me,
Yeah.
where yeah, old men plant trees, for shade they'll never enjoy, or something like that. But I like that idea that that's not the reason. That's not what's motivating. You like, okay, I'm at the point I'm going to do this because it's a good thing to do and it's going to help others, not because I'm personally going to benefit from it. So I like that a lot as well. That's very cool. I have lots of questions, but I would like to turn it over to Catherine and Eric, and give you all a chance to chime in. Eric?
What you were saying about wanting to help people, that definitely resonated with me, because my recent crusade is teaching vet students finances. Because I'm like, if you can get your finances well, then you can practice better medicine, you can take care of your family better, you can take care of your patients better. Like, so when you said that, that totally clicked for me. I'm like, oh yeah, like I totally feel that strongly too.
So I'm curious, Zach, about um, so are you interested specifically in veterinary academia, or are you interested more in mentoring and teaching in a clinic, or can you give me a little bit more?
Yeah. Honestly, my wife used to be a teacher, and one thing that I've kind of learned from her is kind of like, in my perspective, it might be limited, but like teaching is kind of like the ultimate end goal. Is that when you are a master of your craft, the next step to being a master of your craft is to pass it on to somebody else. And so I feel like it's not advocated enough, or at least people don't talk about it enough to get people into it. Because I think when you're really good at something, you should be able to teach someone else that, so that they can go on and do it really well.
Okay. So I'm curious about that part, because as somebody who is both veterinarian and has actually been trained in education, I struggle with this idea that people can walk around and just say, well, I have a degree in X and therefore I can be a teacher. And so I'm curious about your thoughts on that, because my experience does not indicate that that's generally the case, but maybe that has changed.
No, I think I would agree with you. I think that having and I feel like I'm backtracking a little bit, but it's okay.
That's okay. It's okay.
But I feel like you become a master at something, and then you have to go and master something else, right? I don't think that we can sit in one spot and say that I don't need to improve anymore. I think that once you decide that you're a master of something, you decide to go teach it, you should go learn how to teach it as well. There's always a better way to reach your students, I think.
Yeah. So how do you convince your
point though?
How do you convince your teachers that maybe don't believe that to do that?
That's the thing, isn't it?
That's tough.
I was hoping maybe you had the answer, because
Catherine coming in with a tough question.
I know, right?
No,
I would
you're
argue.
saying makes sense. Oh, go ahead.
I was just thinking, I would argue that you can't be a master at your craft without teaching it. And I derive that statement from martial arts, where I see people who like once they start teaching, then they really start to understand what they're doing. I imagine I'm sure there are some disciplines where that is less true, but in my experience, like once you start teaching it, that is the actual path to mastery.
I think that's really interesting as well. But it's complicated, right? Because just because you know something really well or can do something really well doesn't necessarily mean you can teach it well. But I also agree with you, Eric. Like when I try to explain a concept to someone else, that's when I sometimes realize I don't understand this as well as I thought I did, right? And so now I have to figure out not only how does it work in my own head, and then how am I going to explain that to someone else? So I think what you're saying there, that being able to teach it is maybe the final step to mastery. But I also get what you're saying, Zach, which is like, you've gained all of this knowledge. Are you just going to keep this for yourself and not, share anything else? And so I think it's that idea of, well, I've done these things and I've had these experiences and I've been able to put all this together, and now I'm an expert, right? I am, the top of my field or near the top of my field. And so there should be a wanting to give back. But then getting to Catherine's point, which is if you're not able to do that well, and we've all experienced that, right? We've all experienced people who are, good at their craft, but not necessarily able to share that effectively with others. And so I wanted to get back to another thing that you said, Zach, which is, I think, spot on, which is we, capital W, in our profession, don't do a good job of, especially at the level of a vet student, like promote the idea of becoming a veterinary educator. That's this thing that like you're going to go through all this other stuff, and then maybe one day a handful of you will decide to come back and teach, rather than saying this is a career path you can choose and set yourself up to like learn how to do it well. Like that can actually be part of the mastery, is learn how to teach. And I think you're absolutely right. And that's one thing that that's why I kind of wanted to hear your thoughts on like, why is this something you want to do? Because I think a lot of vet students come through and it doesn't even register as an option. And I don't know how much of that is because it wasn't considered before vet school or in vet school, and you see a bunch of people who are doing it. It seems out of reach. Like, maybe you could speak to that some.
Yeah, I think that kind of comes with the stereotype of what a veterinarian is. The cultural like idea of what a veterinarian is that we are perceived on media and stuff as the dog and cat vet at the small animal practice, or like the old cow vet that comes in with their truck, or the vet that's on the horse track, and those stereotypes kind of play into that. But what I've discovered just coming into vet school is that it is a springboard to do whatever you want to do. I came into my first year and I found out what a pathologist was. Like there are people who all different branches of veterinary medicine, and they're masters at their craft. But we don't talk about them enough. You come into school and you meet an anatomist, you meet a microbiologist, you meet a virologist, and all of these people, they're all veterinarians, and it's all pivotal parts of your veterinary teaching. And we just don't think about it because we come into veterinary medicine thinking I'm just going to be the dog and cat vet in my hometown or in my city, because that's what you saw when you were growing up, or that's who your mentor is. So I think exposure is really important.
I think I would say too that for veterinary educators, you do use this term master of the craft often, which I really like, and is very true, but we don't recognize masters of teaching very well, right? We don't recognize those individuals in the class. And like as a student, I'm sure you've gone through this program and I won't ask you to name them, but there are certain individuals that you're like, no, and there are certain individuals that are like, man, they're like an amazing instructor, they're an amazing teacher. I learned so much from them, right? And we don't recognize that, I think, even among faculty. So I don't know, do you all students, I mean, when I was a student, I think I did, but I was older and I had a little different perspective. So I don't know if you all as students are like, man, there's this one instructor that you should take that class, because even if you're not going to be a bovine practitioner, you should take that class. Or even if you're not going to do, small animal medicine, you should take that class. Are there people along your path that you've sort of thought of as masters of their teaching craft in addition to their veterinary craft?
Absolutely. I would absolutely agree with you. I think there are teachers that are just so phenomenal at how they teach that I have classmates that are like, if you want to pass this on to Natalie, you need to take this course because they know how to teach it, understand it.
Yeah. That's good.
But I don't think we always celebrate that quite as much, right? That's something we talk about. Oh, the pathologists are so great at this, or the clinical pathologist, or the surgeon, but we don't talk about, oh my gosh, that one instructor. I mean, I had one when I was in vet school that was phenomenal. I didn't have a single internal medicine rotation when I was a senior veterinary student, and I'm still really good at internal medicine because I had 1 2-hour class with an instructor who just was a master teacher. He was an internist, but he was also a master teacher. So
that's cool. I think the students do recognize, and I think they talk to each other about these kinds of things.
Sure. Yeah.
What I find kind of fascinating is the push and pull between who you like, right? Because they seem really nice, or they're engaging and they care, which is an important part of being a good educator, actually. But sometimes you get, because I can think back to educators that I had that we're very good at teaching, but we're not necessarily always popular. It's like, oh, you learned a lot from this person. And maybe, and there's actually some interesting studies out there showing that the student evaluations for a course don't necessarily always correlate with what the students learned. And sometimes liking a professor, and this is, I don't know that there's any in veterinary medicine, but liking a professor might be because, oh, that course was perceived as easy, or the grading was, I got a good grade and therefore I liked it. It's not a one-to-one. But I always find that kind of fascinating as well. Is it being liked, or is it recognizing that even if I don't necessarily like this person, but I am learning a lot from this person. And I do think one nice thing about vet school is you are getting older students, right? Like they're adults and they can separate that out a little bit better. But you're also like mired in a really tough program, and it's hard to, it can be hard to do that too. So I don't know, any experiences like that, Zach, where you're like, yeah, okay, but I have to give them that, like, they're actually pretty good at this.
Yeah, absolutely. I mean, I've had rotations that I've been like, that was the worst 3 weeks, but it was the most challenging 3 weeks. And I've left those 3 weeks being completely exhausted, but man, what did I like really make some really strong headway with that subject, because that was a really challenging professor. They held me to a really high standard, and they did not demand less.
Yeah. So nice. So Bobby, you touched on the student evaluation thing, and I'm curious, Zach, what can we do to get participation from students, and B, get students to give feedback that's actually valuable, right? Like saying this was a great rotation or saying this teacher sucked doesn't help us. Like we need to know. So help us understand from the student perspective some ways that we might be able to help you all be more involved with that process.
Yeah, that's an interesting question, because there's a lot that goes into those questions. I feel like I'm only seeing it from one side of the perspective. Like I think that student evaluations it's a multifaceted thing. A lot of people get together and they decide, like, how are we going to do these? The school, like Virginia Tech, I know, like when I used to ask certain professors about it, like, why are these evaluations like this? And they're like, well, these are the standards that Virginia Tech says that we have to follow. Like, this is the deadline that they're set at. And like, this is, the way we have to fashion the question. So I guess my question is, like, how do you guys get together to decide, like, this is the question, this is how we're going to ask it? I think there's a lot more involved with evaluations than I can see from my perspective as a student. And I'm sorry that didn't answer your question at all.
No, that's okay. We a lot of trial and error. We do have some prescribed questions that come directly from, academic affairs folks on the main campus, but then within our own programs, we can sort of change those. And oftentimes it's just basically it's data informed, right? So if we get a question that seems to be really bad, or poorly written, or doesn't elicit the things that we're hoping to elicit, then oftentimes we'll go back and change it. The problem is that, to get back to volley it back to your side of the court, is that we often don't get good enough data from students, because we don't either get enough participation, or we get the kind of responses that don't help us out and don't give us the kind of, things that we need to improve the system. And then it turns into this negative feedback loop, because the students don't think we're doing anything, because they don't think we're reading the evaluations, even though we are reading the evaluations. We just don't have enough data to really make any significant changes. So that's, if you can figure out how to get students to participate in a way that's both constructive and provides a specific enough feedback to actually make significant change, you'd probably be a millionaire, because nobody knows the answer to this question. So I just figured I'd ask you, since you're a student.
Yeah, I can give you our perspective. When we get those evaluations, sometimes it comes the way that our curriculum is set up. Sometimes we haven't even had a teacher and we're being asked to evaluate them. And that's difficult, because, you guys are set up in a certain way that you have to have all those teachers evaluated for that course. But I've only had them for one lecture. They're teaching everything next week, and the due date is tomorrow.
Yeah, that's fair.
So that's difficult. And then also, there's just the regular exhaustion of like I have finals next week. How am I'm gonna sit down for an hour and evaluate all my teachers? That,
yeah, no, that's totally fair.
Or I could study.
Yeah. Or I could do something that I know is going to make a difference. Got it.
Yeah.
No, I wouldn't. Yeah.
No, I think that's fair. From
no,
the
it's valid.
Yeah.
I did something several years ago, a little experiment, and I this was pre-COVID, so I guess it's more than a couple of years ago, but course, and I provided the opportunity for an informal evaluation at the end of every lecture. And it was like, what did you like, or like what worked and what didn't work? And that was it. I probably got, depending on the lecture, and so I did it for me and everybody that taught in this course because it wasn't me teaching. And I probably got between about 15, maybe upwards of 5%, which I was pretty pleased with at those. Some were a little bit lower, but even that small percentage, like cumulatively, all I asked were those two open-ended questions. Like they responded if they had a comment, right? And I got some really good suggestions from that. Revamped. I had a lab that I'd been doing pretty much the same way for years, and I thought was really good. and it wasn't terrible, but they were like, they pointed out some problems and then made like this brilliant suggestion for like a small thing I could do to make it better. And I was like, God, why have I not been doing ever? Because I've kind of getting to your point. So the Likert scale questions, I don't get as much out of those personally, and I would maybe not much at all. I realize that's more on like a larger scale, and you need more data points to make something out of that. But the comments, I actually have had really good luck with the comments. And as a qualitative researcher, Catherine, I mean, you're of course, right? Like all of the comments, like that's where all the good comes in. And so like if the students could just skip all of the like just skip, I don't even, just give me some comments, like give me some feedback. Because I think the students actually and more recently, I think like the generation that is coming up, they are used to comments, right? Like they are used to going on the internet and on a YouTube, blah, blah, blah. And like, they know what is good. And now some of them might know how to be really good trolls, but in general, I actually think I get really, really good qualitative feedback from the students. And so I've tried to figure out like, how do I prioritize that? And sometimes I just say like, hey, if you do nothing else, just like tell me something that's working and something that you would have me do, make better. Because I know there's that survey fatigue too, when they're all coming at the same time.
Well, I actually made it an assignment in my course, in my 2 credit hour course, and it was a 5-point reflection. And the prompt was basically in a very professional manner. I preface it by saying in a professional manner, tell me one thing that was the most valuable you learned in this course, the thing that was least valuable that you learned in this course, and 1 or 2 ways that we could potentially make this better in the future. And I had 125 students in the class, and 124 of them were fantastic. So, one of them was sort of annoying, but I mean, 124 really good comments, legitimate.
And I bet it wasn't 124 that were all 100% everything's wonderful and perfect, but like useful feedback. Like here's like, we liked this, but if you did it this way, it'd be even better. And I find that we get really, really good ideas. I've stolen a lot of what they've been given to me freely, but I've used a lot of the ideas that have been provided to me over the years. What are your thoughts, Eric?
I don't think I have anything to add.
Right.
I was thinking about the next direction with regards to Zach, your perspective on becoming a veterinary educator. Like what do you think that process is like?
I think that's a good question, because I feel like a lot of people don't know what it is. Like, I think a lot of people in veterinary medicine think that they need to be like a boarded specialist to be able to come back and teach at an academics situation. And just by like going through this program, I see that that's not exactly true. It's just really like having a want to come back and teach and being able to teach something. So we have plenty of very qualified clinicians at Virginia Tech and Virginia, Maryland, that they're not specialists, but they are like very qualified people in their field. And they have a lot to give to students. And I think that might be a part of solving the problem, is like getting this through to students that like, you don't have to be this DVM diplomat, PhD, 30-year educated, research studied professor to be able to teach at an academic level. We have plenty of skills, and knowledge base that we can teach students that are right at the entry level.
That said, though, it's my understanding you're interested in surgery. So is that the route that you're thinking about going? Which is fine. Obviously, we still need specialists.
Yeah, no judgment here. We need more surgeons too.
Yeah, absolutely. I do want to be a boarded surgeon, so I am a little bit biased. I am kind of the conventional path, but yeah.
That's okay. So can you tell us why surgery? Like, what was there a particular course or instructor or experience that really kind of got you to the point, and sort of maybe explain, was that something you came into vet school knowing, or is that something you grew into, or
Kind of something I fought in a bad way of saying it. So I graduated from Purdue. Just to give a little background, I graduated from Purdue undergrad in 2017, and I had found out that I wanted to be a veterinarian sooner than that, in like my freshman year of college. So I was a little late to the game, so I was playing catch up and everything, and I decided I wanted to be a veterinarian. So like cramming everything in kind of made the whole process kind of muddy, because I didn't have the mentorship that I thought I looking back really needed at the time to open doors and to kind of mold me into the correct kind of vet student, which is kind of a lame term. But so because of that, I had a bit of a gap going from 2017 to when I actually entered veterinary school in 2020, and having that little free time, I spent some time like in the industry working as an assistant, trying a bunch of different hats. But I knew the moment I stepped into a surgery ward, and I was gowned up and we were doing some orthopedics or some soft tissue, like one of the technicians just like took a picture of me and had me in this terrible looking like scrub, like bouffant cap and mask, and I was like, yeah, I like this a lot. And then the more I did it, the more I was like, this is like the bread and butter for me. Like, this is what I really like. But everything else was just as important. So I didn't want to like put all my heart and soul into surgery and then like be disappointed when I started, an internship residency, and I'm like, oh, I actually don't like this as much as I thought I would. So I like saved myself, and I'm like, okay, I love surgery, but what else is there to offer at the moment? Because I think one perspective that I tried to come into vet school with is having this holistic One Health kind of approach of like all of these things play a role into veterinary medicine and really good health for our patients and for our clients. And by just focusing on one aspect of it, I think it's doing a disservice to all the knowledge that's been built up in the other practices. That's why I decided to come into veterinary medicine as a mixed animal practitioner, because I think that there are skills and research and tried and true practices from both like the large animal side that can be used in the small animal side, and the small animal side that can be utilized in the large animal side. And I thought that it was all important. And it is all important. And trying to get through school, I tried to learn all that, and it was a lot. It's exhausting to try to learn all of veterinary medicine and all aspects of it. But every time I went through a surgery class, every time I learned a new, like, just for an example, like learning about the physics of how the cruciate works in the stifle joint, it was just mind blowing for me, because I'd always loved physics. I've always loved like the hard sciences, and like knowing that like all those prereqs that I took in undergrad for physics, and it was super difficult and challenging, like it played a role. Like, and that's how we developed new techniques, because usually utilizing these different practices and all these different multifaceted subjects, we were able to craft the TPLO and like to craft something that's revolutionized orthopedics. And so I get really excited when we brainstorm new things, and like surgery is just something that I feel like you put everything together. It's not just you go in, you cut the patient, you fix it, and then you move on to the next one. It's learning from our surgeon here at Virginia, Maryland. I got to do a short rotation with him. It's 99% of the time you're not in the OR. The most important part is the planning and the post, and being able to, detect problems and work things up, and then have it all culminate into surgery. I think that's something that's really, really special, and that a lot of people don't quite understand, and they take it for granted. And they think that it's just cutting, and it's not. And I think it improves patient care, it improves understanding of the practice that you're doing. It allows you to master things, so that you can teach it to the next generation of people. And so that's why it's so important to me, getting back to kind of that first question of why I think veterinary education is so pivotal, because once you finally understand everything and everything that goes into it, and you master it, like, you want to share it with somebody else. You want to be able to have somebody else experience the same amount of enjoyment that you get from the subject.
You found the thing you nerd out about. That's what I've been saying for years. Like, when people figure out what they want to do, you find yourself like, you can't stop talking about it. You want to talk. You're like, isn't this the coolest thing? Like, look at what they did to make this TPLO and the plate, and how they figured that out. And other people's eyes have glazed over and they've fallen asleep and they're doing other things, and you're still going on because you don't care. So you found the thing you nerd out about. Yeah. Just you talking about it right there, I was like, oh yeah, he's nerding out right now. That's awesome. Because that is like, that's how it was, ultimately for me and certain things. You just start talking and everybody else, you're like, oh, nobody cares, whatever, I'm gonna keep going because this is so cool. That's great. That's very cool. Even though it's surgery, we'll forgive you that. That's, somebody's got to want to do it.
Listen, it's better than poop, which is what Margie Lee nerds out about. So listen, could be way worse. I promise
funny.
you.
We've got a student on rotation right now who is super into parasitology. So I'll tell her you said that.
No, I mean, it's literally just poop for Margie Lee because of all the bacteria and all that kind of stuff. It's literally just poop. She just wants to talk about poop and diarrhea.
Mm-hmm.
That's her thing.
You got to find the thing you get nerdy about.
Whatever you love. It's not for me.
It takes all of us.
So you're telling me that if he was a Connor, he would be a CONNOR.
That's right.
Yeah.
Exactly. Mm-hmm. We were talking earlier about name spelling, and you can remember that I am Connor, CONNER, because I'm an ER doctor. People still get it wrong, but I try to help. Yes. So have you so you've kind of thought about, yes, like you'd like to do surgery, and that is ultimately your plan, and then you're thinking ending up back at a university so that you can teach surgery. Have you given any thought to like, what are some things you can do to set yourself up as you're developing your expertise as a surgeon, how you or maybe your plan is not to do it in parallel. Maybe the plan is afterwards, then try to develop some expertise in the teaching side of things. Have you, and maybe you haven't, and that's okay if you have not yet thought about that, but just curious, what your perspective is on, mastering the teaching side of things.
Yeah. Let me know if I'm not understanding your question right. But what you're asking is, you want to know, like, how am I going to concurrently be a master of my craft, but also be a master at education, and how that lines
up. Have you thought about how that would work out?
Yeah.
Or what it would take to do that? Yeah.
I do try to always kind of keep it in the back of my mind of, like, how would I teach this to somebody? Or what would be the right way to go about this? And sometimes I ask my wife, like, do you remember the stuff about pedagogy when you were in school? And she's like, yeah, I remember it. So I try to ask her. But sometimes what's really nice about the curriculum at VMCVM is we have the opportunity to do a public corporate. And I don't think that it's utilized as well as it should. But what I always try to craft it as, like, how can I use that rotation to, like, follow somebody who is a good teacher, a good educator, or, like, utilize that rotation to be able to, like, teach a class, or, like, learn how to make lecture slides, or, like, do some research into education. And so, like, trying to do it, I feel like it's incremental. Trying to do it all at once is really difficult. Trying to be an amazing teacher that's had 30 years of experience starts by one day at a time. So like remembering that, like, oh yes, I want to be an educator. How would I incorporate that into my daily life? At the same time of like, yes, I'm going to be an amazing veterinarian, and like I'm going to work on this, mastering my craft. I think it's a balancing act. So trying to find opportunities is really important.
You
So
mentioned the public corporate practice reminded we had a track like that at Georgia, and I actually taught an academic rotation, which was a 2-week rotation about what it's like to be an academic. And I, had them do research stuff and teaching stuff, and got a lot of exposure to different experiences. And all of the students who took it were the public corporate students, because everybody else just wanted to learn medicine. You know what I mean? Like, they didn't want to waste 2 weeks learning how to be an academic when they could be on internal medicine or on surgery, or, like those kinds of things. So, but you know what? The world has moved on. That was like fully 10 or 15 years ago that I did that. So maybe now there are students out there who are like, no, like, we'll get medicine too, but maybe we need to learn some other skills.
yeah, we actually have a student, a fourth year. Yeah, she's a 4th year student who wants to set up a rotation through academic affairs to work with academic affairs.
Oh,
and
nice.
see what
I can send you my syllabus if you want.
Yeah, so
that's awesome.
We're going to be working on as part of her public corporate. I think too, though, as somebody who has more education than I probably should, I also think that there needs to be an understanding for students who want to go into academia that teaching is a hard thing to do, and being an educator isn't something that, for some people, it does come a little bit more naturally than to others, but it's also, there's a language associated with it. There's a discipline associated with it. There are different specialty areas within education that you can go down. And I think that's one of the big things that we don't do a great job of in the academy writ large, right? Not just veterinary medicine, but we say, again, you're a master of your craft, you know your content really well, now go teach it. And what we forget is that the experts in the fields are often the worst people to be teaching, because they're teaching you up here and the people that you're teaching are down here, and you need to figure out how to get to a point where you remember what it's like to be entry level. So I love that you're excited about it. And I know your wife's an educator, and hopefully she'll remind you, but keeping in mind that it shouldn't just be an experiential situation, right? Like, that individual who took 30 years to be really good at their craft in teaching probably could have done it in 10 if they had pursued a little bit of additional training and a little bit of additional research in a different area of expertise.
Absolutely. I'll take that to heart. That's definitely haven't thought of.
Yeah.
Well, and it's
education is what I nerd out over. So
yeah, but I think it's important. It's a good point, because Zach, you've said a few times, like, we're not doing a good job of explaining that. And I think we're in the middle of a bit of a paradigm shift in veterinary education, to where 10 years ago, maybe less than that, it was completely acceptable for everybody who was teaching in your vet school to just be a content expert. You are an expert and you have zero training in education whatsoever. And we just say, yeah, you'll get better over time. Whatever, just go in there. And that's still happening a lot of the time. Like, you hire new faculty and they've never taught, and it's, here's your first lecture. And you're like, what do I do? And they're like, you'll figure it out. There's still a lot of that, but there's also a move that we are in the middle of. And the group of people you're talking to now are big proponents of this. And there are organizations dedicated to, caring about veterinary education. And it's not just veterinarians that are involved in that, right? We've got educationalists and other, instructional designers. There's all sorts of people who are involved in this movement. And our hope, I don't think I'm overstepping. Our hope is that eventually it becomes that you aren't just going to step in to be a veterinary educator when the only training you have is in your medical specialty. I think we all would love to see where you are a specialist in your craft, the craft of medicine, and you also have specific additional training in how to convey that to others in an effective way. So you're in the midst of that right now. And so, yes, if you would take that to heart and say, hey, I recognize that by the time you would finish a surgery residency and be looking for jobs, is it still possible for you to get a job without any education training? Probably still will be. But we're trying to raise that bar. We're trying to say maybe that isn't quite enough. And so I would encourage you to start thinking about now, one, are there things that you can start doing to maybe, again, get that training in parallel? Or when you do, go to first job at a university, find a place that's also going to say, this is important. And therefore, here's the opportunities for you to get that specific training that we're just not going to throw and say, you'll figure it out on the job, because it's too important. Right. Like, I mean, you've that, Zach, you've been talking about the importance of making that. And so I was late to the game. I definitely got thrown. It was like, yeah, just, kind of do what you've seen people do. And, and oh man, I could have saved so much time. Like Catherine was saying, like I mean, I'm in the middle of my master's in higher or in educational psychology right now. There's so many things I'm like, man, I didn't need to take 10 years of trial and error to learn that. Somebody already knew that. Like, it's maddening at times.
I have a
so know that
dream
that's
to
out
have
there.
our residency masters be an MED.
Yeah.
So that they do their residency, but their classes are in education, and that we become the residency where you go if that's what you want to do.
Yeah. Which I think is awesome.
That's what I'm hoping to build in our residency here.
Yeah. I mean, people weren't even talking about this 10, 15 years ago. Right. I mean, it just wasn't a thing. And so it's kind of neat to be on. So you're in a really good position timing wise. A lot of things in life happen because of timing, and you're in a situation where you're in kind of smack dab in the middle of a really, that with, brand new 15 brand new vet schools opening up over the next 6 years too is also really helpful. But I don't know, Bobby, if you have an opportunity on this, but we have about 15-ish minutes left. And I was curious if Zach, if you had any questions for us.
That's great. I love it.
Well, Dr. Connor said I didn't have to prepare anything, but I do.
No, you don't have to, but I just didn't know if there was something that
but he did anyway
in the course of the conversation, and just wanted to give you an opportunity. So
yeah, I mean, this is something that I ask my vet mentors all the time, is like, what is the future looking like? How are we going to be figuring out these, as we're trying to fill positions all across the board in veterinary medicine, how are we going to prioritize education? I think a master's degree is a phenomenal first step. But what are your thoughts on it?
Well, I have all kinds of thoughts on it. I think there's some trepidation about 15 new vet schools opening up because of the time that it's all happening so close together. But and I have similar concerns, but I also am really excited about that, because it means that for the first time in many, many decades in the United States, there's going to be pressure on these institutions that have always rested on their laurels and said, we're going to continue doing it this way because we've been successful enough, right? And for me, successful enough isn't good enough. And so we have 15 new vet schools coming online, which means there's going to be 15 new ways of potentially approaching a veterinary education that could open the doors in ways that maybe wouldn't have happened otherwise. So, things like maybe doing a part-time program, or doing a hybrid program, or doing a more flexible curricular program, or setting up in a way that's a little bit different. Like the University of Arizona has a 3-year program that's completely team-based learning, right? Which nobody would have ever done 15 years ago. So for me, I think that in and of itself is really exciting, because it also is going to require us to have a better understanding of the educational principles and practices that go into building a program that can potentially be successful in a way that's unique. So that to me is one thing to think about. I think the other thing to think about, you sort of talked about staffing those schools, which is, I think, a big concern for everybody. But the fact of the matter is that, as you know, I'm a non-specialty boarded person. My specialty is education. But I did practice for 13 years in GP. And almost 70% of our students go into GP practice. And so we're going to have to dig into those people who are in clinical practice, that have experience, that have a lot to bring to the table, as you indicated, that can come into the classroom and say, I'm not an expert in clinical pathology. I'm not an expert in surgery. I'm not an expert in dermatology, but what I am an expert in is understanding clients. I am an expert in the spectrum of care. I am an expert in relating to my team and managing a team. And I am an expert in managing a general practitioner's caseload. And from that, you can learn a lot. And so I think bringing those people into the fold is going to be really important. And it's a great opportunity at this juncture, because we do have so many clinicians out there who are sort of burned out and they're looking for something different. And this is a way they can still use all the experience and skills they've gained, give back to the community, give back to the profession, and maybe have a little bit better quality of life in some ways. So those are my thoughts. I could probably go on forever because, again, education is what I nerd out about, but I will turn it over to Eric and Bobby.
I think
all right, Eric, what do you think?
Yeah, I generally agree with you. I think that I may be slightly pessimistic because having been in both more traditional institutions and more cutting edge institutions, people are going to have to retire or die.
Yeah.
You know, like that's fundamental problem is like the leadership has come up with traditional education veterinary systems and don't understand anything else. So I think that I definitely agree with you that those, like, this is the way we've always done it, things are going to start to be challenged and really start to, you know, I wonder how it's also going to affect the students. Like, you're going to have some students that are going to look at the tertiary care hospital education system and be like, that's what I want to do. Like, yes, let me learn how to do anesthesia for a pulmonic stenosis balloon, which always kills me. I'm like, what the hell are we teaching students doing this? And you're going to have other institutions where they don't have a tertiary care hospital and they maybe do just general practice, or they do the distributive model. And then you're going to have students like being like, oh, you know, that's where I want to go. I think that the main problem with that right now is I think all of the US distributive models are private. So
you mean the schools are private?
Yeah. So the tuition basically is currently, you know, if you can get into your state school, get into your state school, and all the state schools are traditional.
University of Arizona is a state school. And they just graduated their first class and they're
okay. Right. Yeah. Okay, cool. Okay, interesting. Yeah.
And we have a couple more that are online that are not private. So Texas Tech is coming online, and then but two of the bigger ones, Lincoln Memorial and Western, are certainly.
Yeah.
So I hope that when that choice will be available, and then students can, you know, hopefully choose more effectively what would work for them. Yeah. I don't know if that's a little bit idealized. I don't think that people probably choose what's best for them.
I think when you're trying to get into vet school, you're like,
exactly.
You take.
Yeah.
Tuition is an option and you're not talking about private schools. That's going to be my first choice. But other than that, who will take me? Now, the other thing is with more seats available, right? That could change that dynamic of choice. It might take a little time to realize they have more, but I want to touch back on something, Eric, you had said just kind of offhand. You were talking about the traditional, you know, model of vet school. And this is something that I find fascinating because tradition, we call something a tradition when there's literally no other justification for it, right? Like my family gets together.
Has a tagline that says tradition is just peer pressure from dead people.
I love that.
But it's like we get together, you know, to read a Robert Frost at Christmas. Like that's a tradition. There's not I don't brush my teeth every day because it's tradition, right? There's a reason that I do those things, but like tradition is when there isn't a reason to do this other than it's tradition. And so when we talk, like when you use the term traditional vet school, like I think that encaps problem is that we're doing it this way only because that's do. And because if there was a reason, we would just state that reason. There's a reason I brush my teeth. It's because it's for dental health and hygiene. And so that I can have bad breath. So people don't want to, you know, run. Like there are a list of reasons to do that. So it's not a tradition, even though I do much the same time every day. Like it fits the other criteria of a tradition. And so I love that traditions are going to start being challenged more and more. I do think we're going to have, a bit of an issue for a while, right? One of the reasons all these vet schools are opening up is because we're not making enough veterinarians, right? There is a problem. A lot of states have done their analyses and been like, we don't have enough vets. The problem is we can't get enough vets, and our state doesn't have a vet school. Not all of them, but a lot of them, our state doesn't have a vet school. Therefore, we need a vet school, or ours isn't producing enough for our state, so we need another one. So we recognize there's a a gap between what society needs and what is currently being produced in our field. And we're not even going to get into the technician issue, but the other problem is building all these vet schools at the same time. We're going to be drawing clinicians from wherever, and so challenging, because not only are we saying we don't have enough veterinarians, we now need to pull them from that pool that there aren't enough of to teach the next generation. Long term, I think ultimately this is a good thing. Would it have been nicer if it could have been more gradual? Probably, but like everybody recognized at the same time, holy crap, we have an issue, we don't have enough, let's this problem. And so long term, this is, I think, a good thing. Short term, things are going to be really tough for a while. Job security, though, is going to be.
I think the next economic crash will help solve a lot of that. I mean, I remember in 2008, 2009, 50% of our students didn't have jobs.
Yeah.
So like everyone, we've been on this 15-year tear in the economy. Everyone's like, oh, we need vets. I'm like, yeah, you do, until the next downturn.
Yeah. Well, I can. In 2008, I recall there was this discussion in the ECC specialty, was like, we're training too many residents.
We had the same talk. Yeah.
And now we are like, I want to go back and start smacking some of those people and be like, we are struggling, right? So but it's challenging to weather those storms, right? Like it is, because when there is that downturn and people don't have jobs, you're like, this is an issue. And then we get into this. So it is, the pendulum's going to swing back and forth. We're going to see our highs and our lows. But yes, I think now if things could coincide, right? Where like, as these vet schools are coming on board, we have a little bit of an economic downturn, and like, that's okay for a while. But if all of those places lose their funding, that becomes a different issue. So, we'll just see what happens. I don't know about, Eric, you or Catherine. I can't personally see myself ever not being an educator in better. Like I've talked about this. People have said, I could pay off my loans a lot faster. I can do all these other things going out into prep, but I can't see myself in a field of veterinary education. I don't know about, Eric, what do you think? Do you see yourself moving to private practice ever?
One of my mentors actually is in private practice now after being in academia for a long time. And I just like look at him like, I don't understand what's going on with you, dude. And he's like, it's great. Like I am the one who is like taking care of all the patients and making their pain go away. And like he gets a lot of satisfaction of like that sort of ownership, But I see that, I'm like, but you got to work 50 weeks a year, like when we're off clinics, it's not that we're just screwing off at home, but it really is, you have a lot of flexibility. That actually is where my wife decided to do academia. She did an academic rotation at the pharmacy school, and she was like, this is great. I like this lifestyle. It's not an easy one. It's just not a 9-to-5 job one, So yeah, I see people in private practice. I'm like, I don't want to do 8 to 6, 4 days a week, the whole year round. Like that does not sound like fun to me.
Yeah. I've done private practice. I've done the 4-day week. I've done the 5-day week. I've had to work the weekends. I've had to work the holidays. I knew I was not going to like private practice, so I was a little biased going in. It's not ever what I wanted to do. So and I will say this, if I stay in veterinary medicine, it will be in an education capacity. There's nothing you could do to convince me to go back to full-time clinical practice and if I did go into clinical practice, I would still be creating opportunities to mentor. So I would be having veterinary students come through the, program, or veterinary technicians or whatever. So for sure. So education is definitely a core part of who I am and sort of where I feel like I'm supposed to fit into the world, for sure. I
think it's awesome, Zach, that you want to go into education. And so I just want you to hear, like, there are people who are like, yes, this is also the thing that we nerd out about. And again, to highlight that it is hard and to do it well, you can learn about it. It turns out you can learn to do it well. You can be taught the principles of how to do this well, so that you don't have to take 30 years before you're good at it. So that's also kind of cool.
Yeah.
What were you going to say, Catherine?
Oh, no, I was just going to say, and maybe we'll talk about this on a different program, but I'm actually working on a research paper with some colleagues right now, which has some pretty interesting findings that indicate that students who go through a formal mentorship program, and this is small animal practice, go through a formal mentorship program coming out of a distributive model are much more comfortable with general practice things. And students going through the same mentorship program coming out of a quote unquote traditional sort of VTH based model are much more comfortable with the emergency type things. And I think that's really interesting because that's tertiary care in some ways, right? Not all, but in some ways a little bit more advanced versus some things that are a little bit not basic, but are still considered that general practitioner, that those two models shook out that way. I think that's really fascinating. So I'm excited about getting that paper prepped and out there because I think it's going to be really interesting for people to read.
It very much is.
Yeah.
Zach, final thoughts or questions?
An example of some of the educational research you can do when you go into education.
Oh, that's true too.
My final thoughts is it's really nice to be able to find people that will have a love for veterinary medicine, but also have a true love for education. And I think finding people that have the same interest for you helps you understand that that's something that's really important for you. And that you can see yourself in those people, and therefore, you can do it yourself someday. So I thank you for letting me come on the show and talk to you guys. It's been really great and educational for me.
Thanks for joining us.
Well, we'd love to hear that. Yeah, it's been awesome to have you and to hear your perspective and to let us rant a little bit about some of the things that we nerd out. It was fun to hear you nerding out about certain. For me, thank you so much for joining us. It's not always easy to come on a podcast like this and be like, no preparation, just come talk to us. We'll see how it goes. So kudos to you for being willing to just kind of come on and experiment with us. But yeah, it's been great having you.
Thank you.